Hey y'all, it's Ashley aka Miss Glamour Puss, and I wanted to come to you guys today to give you some more information on my breast lift and augmentation that I will be getting on March 12th of 2014. Today is March 7th, so basically I have 4 days and a wake up, and I will be going under the knife. I will be getting a breast lift and silicone implants. So I gave you guys a little bit of information the other day, but I wanted to go into a little bit more detail and answer some questions that I received. So I had a list of, if you hear me fumbling around with paper, piece of paper here, I had a list of questions that I wanted to ask my surgeon, and so I'm going to answer those questions for you because they were answered for me. And I'm going to start with number one. My first one was, how do you determine what profile implant that I need? And for you guys who have been doing some research into breast augmentation, you'll know that there's several different profiles. You can go for a more natural profile, a moderate profile, you can go for a high profile. And basically profile is just going to be where your breasts sit on your body, how far your nipple is up. Some people want the Barbie doll look where their breasts are really high. Some people want a medium, and some people want a more natural look. So I had been hearing a lot about profile, so I asked my surgeon about that, and basically he said that, you know, I'm going to show him some pictures of what the look that I'm going for, and based off that look, that'll kind of determine what profile he'll give me. But when I go into surgery, he's actually going to take a look at my anatomy and make the best decision. I think that I'm probably going to go for a moderate high profile, which is a little bit higher than normal, but I definitely don't want to go for the Barbie doll boob. So we'll see what happens when I get there. My second question was about nipple direction, and I had that question because I had been watching a lot of videos and I saw people whose nipples seem to go different directions. Like some people's nipples seem to kind of like go outward, some people's were straight in, some people's kind of went up. So I asked about nipple direction because I really didn't want any weird nipples. I'm okay with my nipples the way they are now. I'm also okay with the size, and she said unless my nipple was just huge, you know, it's fine. They won't change the nipple size, and the nipple direction is really based off of your the direction of your nipple now. So if your nipples kind of point out now, that's how they'll be. If they point in, that's kind of how they'll be. So I don't have any problem with my nipple direction now, so I should not have one afterwards either. My next question was over or under the muscle. She said 99% of the time they go under the muscle, and that just gives for a more natural look. That means that you'll have your breast tissue, your breast muscle, and then the silicone is going to be placed under the breast muscle. There are a few occasions when they go over, and there are also some occasions where they go half under, half over, but I will be getting under the muscle implants based off of my anatomy. My next question was post-op visit cost. Some people are charged for post-op visit cost. My post-op visit costs are included in the cost of my surgery. My surgery is $9,000, but because they were running a special at the place I'm going to, and because I'm paying cash, my out-of-pocket cost is $6,000. So I'm paying $6,000 cash for the whole entire thing. Plus I paid $25 for them to fill out my FMLA paperwork. Creases needing lowering. That doesn't really go with me, but some people have small breasts to start off with, and depending on the size of the implant that they're going to get, they may have to have their creases lowered. So if you're maybe an A cup or very flat and you want to go to a large implant, that may be something that you have to worry about. I was a full C, almost a D, before my weight loss, and I was actually a good full D when I was pregnant with my daughter. I have definitely the skin for, you know, the implant. I don't really have to worry about having my creases lowered. Pain medication, I'm going to be medications in general. I'm going to be prescribed Loratab for pain, Valium for muscle relaxer, a Z-Pak as an antibiotic. And if I have any problems with using the restroom, she's going to recommend a laxative. Okay? I'm sorry, a stool softener, not a laxative. I asked about surgical tape, and what I did is I actually went and had a test run because I have sensitive skin. And what she did is she did a line of just the adhesive that they use. She did a line of tape and adhesive, and then she did a line of just the tape. And unfortunately, the tape peeled right off because I left out of the office and went to boot camp. But she was trying to make sure that I wasn't allergic to any of them together or separately. So far, I don't have really reaction. The dark you see right here is just kind of the stickiness of the tape. So, okay. I asked her, just do they use sizers during surgery? So basically, if I tell them I want 400 cc's and they get in there and determine that one will be larger, are they going to take different size implants into surgery? She said yes. I told my doctor that I'm comfortable with anything between 425 and 475. I'm thinking 450 is really where I'm going to end up going. But if he had to go to 500, I wouldn't be concerned. I don't want to get anything over 500. I really want to be a D, and I'll be okay with being a double D also. So, I asked about smooth or textured implant. She said that they only use smooth at her site, and that the textured were used if, usually if you were having reconstructive surgery, like if you had a mastectomy or something like that, or you had to have a breast removed or something like that due to maybe cancer or something. So, I'm having a smooth, implant, and the type of implant that I'm going to be getting is a Mentor implant, Mentor silicone implant. Okay. I asked her what happens if there's a life-threatening emergency during my surgery, and they are basically a fully functioning hospital with crash carts and everything there, and there's also a hospital right across the street, and there's a little bit down the street, and there's a paramedic right across the street, so I feel comfortable with that. I asked about the anesthesiologist. The anesthesiologist will be there overseeing, but a registered nurse anesthesiologist, a registered nurse who specializes in anesthesiology will be administering my anesthesia, but they do have a anesthesiologist on staff to oversee them. And the profiles, again, that you could get are classic, moderate, high, or ultra high, and moderate plus. And I think I'm going for moderate plus. So but I might end up with high. I don't know. Like I said, my doctor is really more into like looking at your anatomy and making sure that the implant that you're going to get is going to look good on your body, not just, you know, you saying you want something and he knows it's not going to look good on you. You know, he kind of leaves room for some discretion, and based off of his surgeries, and I've looked at his profile pictures of surgeries that he has done before, I feel completely comfortable leaving that in his hands. My implants have a lifetime warranty. And I'm going to be bringing I have to wear a Postop bra, which basically zippers or snaps in the front. I've already purchased those, and I purchased 2 different sizes, so just to make sure that I have some options in case one doesn't fit, because I won't really know how big my boobs are until after it's done. So I just wanted to make this video for you guys, just to answer any questions that you may have. And I'm so sorry I keep touching my hair, but I don't know, I love this hair. I'm all about this straight hair right now. But I wanted to answer any questions that you guys had, and then I'm going to do another video probably this weekend, and I'll actually show you guys a before picture in a bra. I'm not going to just show you my actual boobs, and then I'll show you one after my surgery also. And if you have any other questions, please leave them down below, and I will answer them. And until next time, bye guys.